Yeah, it's a good one, isn't it? Steve Stanley there, Rest in the Father. This is Rhema, Brekky here on your Monday morning bright and early. Good to have your company, Mick Wright, with you through until 9. It is 9 minutes after 8. And like I have mentioned before, our very, very special guest this morning, Dr. Gordon Reid, MP, who coincidentally is the federal member for Robertson, is sitting opposite me here in the studio. Gordon, good morning to you, mate.
Good morning, mate. It's a pleasure to be here. Thanks for having me.
And it's your first time too, by the way, being in the studios.
It is, and not just my first time in this studio, but my first time in any radio studio. So got pre-selected for the federal election during COVID, so everything was over the phone or on Zoom or on Teams, so it's extremely exciting to be here.
Awesome, mate. Look, thank you so much for taking time out of your busy schedule. I can imagine being, firstly, a GP and also an MP. You've got a whole lot of balls juggling in the air at the moment, I'd imagine. So very, very busy. So before we kick in this morning, I just wanted to get a bit of just let our listeners know a little bit the Gordon Reid story. How did you get involved? Number one, medicine. Yes. And secondly, into politics too, because I would imagine that it's probably not what you'd be thinking that you would be going into being a GP. Yeah, politics. So
I'll give your listeners the slightly condensed story because no one likes to hear a politician waffle. But basically, I always wanted to work in some health capacity or in some area of health. My father was a nurse and a paramedic. My auntie's a nurse. We've got plenty of family members who are in that space. And I remember one of my grandparents who was in hospital at Gosford Hospital actually when I was young, and I was seeing all the people dressed in green, all the doctors in there, and thought I'd like to do that and continue that forward, and was lucky enough to study medicine at the University of Newcastle, and finish off my senior medical student rotations at Gosford and Wyong Hospital, and then was lucky enough to do my internship, residency and the like on the Central Coast, which was almost a dream come true. Nice. And then I suppose the transition into politics from emergency medicine to that, The story I give, it was between two of the major outbreaks of COVID, the two big peaks of the two variants. So we were still seeing people come in with COVID, but also people that were sort of coming out of home because they hadn't been out in a while. So people who hadn't seen their GP in a while, people who couldn't afford their medications, people fleeing family and domestic violence, people who just had nowhere else to go. And you sort of take a step back and think, well, I can either complain about it or I can do something about it. And I was successful in my pre-selection as a candidate in the federal election, and myself and a small team, we went out into the community and door-knocked thousands of homes, and we were ultimately successful in that election. So that's the very condensed version, but I'm very big on the fact that you can either complain about it or try and do something about it, and you won't fix everything overnight, but you can at least give it a red-hot crack.
Yeah, absolutely. What were some of the biggest, you just mentioned a couple of things there briefly, what were some of the biggest issues that you saw, I guess, in the way of health? You mentioned that obviously a lot of people, we were stuck at home at different times during different lockdowns, and being a part of, Sydney as well. Yes. It was an interesting one too, because, here on the coast, we're very pro-coasties. Yes, we are. Very independent, but all of a sudden we were lobbed in with Sydney, and it was like, hey, this is not right. Yep. But we had to work with it. But what were some of the major, I guess the key things health-wise that you saw people really struggling with during the pandemic?
And I would say fiercely independent as a coastie. The Hawkes River Bridge up, that's ours. But no, so look, during the campaign, but also even now, during my time as the member for Parliament, the two major health concerns that I hear about are access to a GP or timely access to a GP. Sure. So either people have to schedule to be sick or they can't afford to get into to their local doctor, and also to medication affordability. Is the other one. So one thing that I've seen previously is people have to ration their medications. So take, for example, hypertension, which is high blood pressure, or hypercholesterolemia, which is high cholesterol. Sure. People take that medication maybe every second day or every third day because they can't afford it. And what happens then is that high blood pressure or that high cholesterol becomes a stroke or a heart attack. And then they end up seeing me in the middle of the night, which is what we're trying to avoid. And while the government has put in place policy and legislation, particularly around tripling the bulk billing incentive for doctors, and also to the 60-day dispensing for pharmacies and lowering the price of PBS-listed medications. We've still got more work to do in that space because people are finding it difficult to get into a doctor. So I won't stop in that area, and I would expect everyone listening here today to write into me to let me know what's happening on the ground there, and I'll keep advocating for you in Canberra.
Yeah, absolutely. That is what we want to hear, particularly when it goes on to public health. That's where we really need to get more of a kick along there, and a lot of people, particularly in this economic climate, doing a little bit tough for a lot of people these days.
Yeah,
so
right.
I guess that, and again, like you said, if people out there with chronic health conditions, they need that timely access to GPs. Now, you're still practicing as well?
Yes, I am.
Yes?
I practice as an honorary medical officer at Wang Hospital in the emergency department.
Big shout out to everybody up that way this morning as well. So, look, now, hopefully you'll never have to see Gordon up that way, but if you do, you've heard him here.
I'd much prefer to see you in the office or when I'm out door knocking.
Absolutely, absolutely. We're joined by a very special guest this morning, Dr. Gordon Reid, who we will be chatting to him just after this coming break about a very special event happening this coming week as well, which is a big barbecue here on the coast for men's prostate cancer awareness. So make sure you stick around with that one. This is Rhema Brekky here on your Monday morning. It's 20 minutes after 8, Rhema Brekky here on your Monday morning, Natural State with Steady, and of course joined by a very special guest in the studio this morning, Dr. Gordon Reid, the federal member for Robertson and a local GP as well up there at Wyong. And Gordon, now look, you came in this morning specifically to have a bit of a chat about an inaugural event that is happening this coming week. It is the Central Coast Big Aussie Barbecue, proudly hosted by the Prostate Cancer Foundation of Australia. Can you have a bit of a chat to us about that one? It is a big deal, isn't it, prostate cancer with the blokes? Yeah,
look, absolutely. So a few months ago, we held a women's health forum at the Ocean Beach Surf Club and discussed multiple issues there. Menopause, access to primary care services, and the like, and it was quite successful. We had over 100 women there, and some experts in the women's health space, including Dr. Colette Hourigan, and the team got together and we thought, well, we'd like something in the men's health space. So we got in contact with Bayer Pharmaceuticals, and also the Prostate Foundation of Australia, Prostate Cancer Foundation of Australia, who is headed up by none other than Jim Lloyd, the previous and former member for Robertson. So it goes to show that this is a bipartisan issue, that's for sure.
Sure.
And we got together and we thought, well, what's the best way that we can not only raise awareness for prostate cancer and men's health, but how can we get people together to talk about these really important issues? And that's what the barbecue is all about at the Davistown RSL on the 21st of September.
This Thursday?
Yes, this Thursday, starting at 12 p.m, where we will be discussing these important issues. Tens of thousands of men are diagnosed with prostate cancer right across the country, and it's actually interesting, on the Central Coast we have higher than the national average of men being diagnosed with prostate cancer. So we really need to be talking about this important issue. Yeah. We need to be nipping it in the bud early. We need to make sure that we're getting on top of this, and we need to be proactive. We can't be reactionary with prostate cancer.
Yeah, absolutely. What's the prognosis for men who, like you say, they get screened early as soon as they notice anything that's happening in the body that could be an indicator of prostate cancer? Firstly, before we get into the prognosis, what are some of the things that the men should keep an eye out for?
Yeah, so there's a lot of different symptoms with prostate cancer, particularly early on. Sometimes men are diagnosed through screening with their general practitioner or primary care practitioner. And then following on from that, you can have lower urinary tract symptoms, so difficulty emptying the bladder, terminal dribbling, potentially blood in the urine and the like. So there's a whole gambit of symptoms that can relate to prostate cancer. And what I'd recommend that people do is they go to the Prostate Cancer Foundation of Australia. They can look at the Movember websites and all the men's health websites, but also to talk to their GP. Your GP is the most important person in this conversation, because not only are they going to coordinate your care, they're also going to make sure that they are educating you about what prostate cancer means. And what this barbecue is about is to make sure that people, one, are aware of prostate cancer and its prevalence, or how often it's happening in the community.
Yep.
But also to what they can do about it. You know, who should they see? Who should they talk to? What supports are available for not just them, but also their family. We know that families, carers and their support networks are a huge part of the treatment and care of patients receiving treatment for prostate cancer, so they also need to be included in the conversation.
Yeah, now you mentioned it is the nation's second most diagnosed cancer in men. Around 17,000 odd blokes are diagnosed with it every year. And as I mentioned before, prognosis, if we get onto prostate cancer early, what are the prognosis for the blokes?
Yeah, so if prostate cancer is detected earlier, the prognosis is more favourable.
Yeah.
And that's like any disease, but prostate cancer in particular. So men on the Central Coast, I would encourage you to please come to our barbecue at the Davistown RSL on September 21, so that's this week, on Thursday from 12 p.m. till 2 p.m, so that we can discuss what prostate cancer is, what it means for our community, and how we can beat it.
Yeah, and traditionally, I guess, to us dudes, we really haven't been the best at keeping on top of the health issues, have we?
Yeah, no, that's right. You know, men don't often like to talk about their health issues. Yep. They often seek medical attention later than women, which can lead to a delay in diagnosis, which ultimately will affect prognosis of any condition or any disease. So people out there listening, we really need to encourage men to talk about their health, talk about their medical issues with their doctor, and also in places like this at the barbecue.
Absolutely. Now, it is a simple blood test if you head into your GP to get tested for prostate, or
so it's there's a suite of things. There is a blood test, a PSA blood test, but also too there's the medical history, which is extremely important.
Sure.
And also to a physical examination, and then once those things are completed, a clinical picture is formed, and then the GP will ultimately make the decision as to whether further investigation is needed or referral to a urologist. So the GP would be the best person placed to make those clinical decisions. But yes, see your GP.
All right, well, man, this is one for you. And, of course, all the ladies listening out there this morning, if you have a man in your life who, you want to make sure that he keeps on top of his health, and oftentimes it is the ladies who will be giving us a bit of a smack up the ear on, hey, you need to get to the doctor. It's been a while since you've had a checkup, so even if they have to drag you there, make sure you get there. So, again, this coming Thursday, September 21st, down there at the Davistown RSL between 12 p.m. and 2 p.m, it is the inaugural Central Coast Big Aussie Barbecue, hosted by the Prostate Cancer Foundation of Australia, and, of course, our very special guest this morning, Dr. Gordon Reid, MP. He will be there as well. And, look, men, make sure you get along to that one if you possibly can make it. Prostate cancer, again, it is the second most common cancer diagnosed amongst men in the country, and unfortunately, with the Central Coast, it is a little bit higher than the national average, isn't it?
Yep.
What would there be, what are some of the factors that could lead to that? Is it more of a lifestyle thing, a genetic thing, a bit of a combination of the two?
Look, I think it's a combination. Also, too, our doctors are better at screening for prostate cancer and detecting prostate cancer. Also, too, our men are living longer. All of those things, genetics, lifestyle, doctors getting better at detecting it, which is a good thing. We're able to detect it earlier on, but we just need to make sure that we're having the conversation.
Yep, absolutely. Thank you so much for coming in this morning, Gordon, and gracing us with your presence here. This is the first time again, so we've sort of ticked a whole lot of boxes this morning for yourself.
Yeah, no, thank you for having me. This is fantastic. The microphones and the headphones, it's all been fantastic.
It's all happening. So we will definitely get you back in at some point down the track. We'll have a bit of a chat. Probably some more political things and some health things as well. So we'll some of the things that are happening around the community. We love to keep people informed of what's happening there. It is a great place to live. God's country, as we call it here on the Central Coast.
Absolutely.
So make sure this coming Thursday, boys, 12 p.m. to 2 p.m, Davistown RSL. Make sure you head along for prostate cancer awareness there. It is the inaugural Central Coast Big Aussie Barbecue for this very, very important subject. Stay with us. Some more great Christian music still to come as we head on up towards the 8:30 news. This is Rhema Brekky on your Monday morning.